Hello, Board of Education and Community. We are here to present the Youth Risk Behavior Survey results from 2021. I'm Luke Pinion, the Chief of Pupil and Family Supports.
I'm Emily O'Connor, the Director of Student Success.
I'm Laura Stevens, the Health Officer and Director for the Wauwatosa Health Department.
All right, and please follow along on the slide deck. There is a lot of data in our presentation. First, we just wanted to situate and explain what the Youth Risk Behavior Survey, or what we will refer to as the YRBS, is, which is an anonymous survey used across the country. It is really developed by the U.S. Center for Disease Control and Prevention, so the CDC, which we're all very familiar with at this point in time, and it monitors different health and risk behaviors that we might see in our youth. So things such as traffic safety, weapons and violence, different types of mental health concerns, alcohol, tobacco, and other drug use, sexual behavior, as well as diet, nutrition, and exercise. The CDC and the Wisconsin Department of Public Instruction do the survey every 2 years. It's generally in the spring of odd years, so we will be queuing up to administer it again this spring of 2023. And it has been administered since 1993. A little bit of background on our 2021 data. Our students took this survey 6th through 12th grade in the fall of 2021. It was delayed because of the pandemic. It took just about 1 year for the data to come back to our team in a summary report, and these are very, very robust 100 plus, 150 plus page reports. So it took a lot of effort and collaborative effort with our partners at the health department to really make this data concise and digestible for you all. The reports that they give us also do not include any prior years or trends data, so we did have to do some unearthing and pulling previous reports to be able to tell the storyline of how our outcomes have evolved from prior years' assessments. So again, a big thank you to the health department. They've been a great partner in this. And I do want to say we are still waiting for an overall summary report from the state of Wisconsin, but we tend to see that our outcomes do generally align with some of the statewide trends. And then what do these results mean? So of course, when we look at the results, we're going to talk about where we can allocate and shift different resources, where things are going well for our students, and where there may be opportunities to support our students differently or provide different resources. It is important to remember that all of these outcomes are self-reported. They are not representing actual diagnostic psychological conditions, but they are reported from students themselves. And they are 100% anonymous, and they really stress the importance of keeping that anonymity so students are truthful in their responses. And then again, these data really help us understand where we may shift resources, as well as help us advocate for different grants and things that might help further advance our goals. When we look at who took the survey from 2021, you'll see two graphics here. The blue one is our high schools. We had both of our high schools participate, and you can see there the percentage of each grade that took the survey. And the CDC will say anything that's 70% or higher is a really strong response rate. And then anything between 51 and 70 is fair. So we're doing fairly well in terms of the amount of students taking the survey. And then at the middle school level, what you'll see is they are combined between our two middle schools. There was an error 2 years ago, and both schools registered under the Longfellow account. So we do have over 1,200 usable surveys representing individuals from both schools. However, it is all under one report. We have corrected that for the 2023 administration, and we will be able to disaggregate our future data as we made sure they registered as two different schools. I also want to quickly explain the key you'll be seeing. If there is a gray box, it just means there was no question asked, or they changed the question, so it wasn't the same in a different year. If you see the hyphen, it means there wasn't enough respondents to that question to even give us a 1%. And then anything coded as green is really positive movement or movement we want to see in a desired direction from 2019. Anything in red is going to be movement that we're seeing in a direction that is not desirable.
Okay, so let's dive into the data. So here you'll see we'll start with some mental health impact. And unfortunately, we do not have trends yet for the middle school. These were new questions added. But for the high school, we can see at least 4 years worth of data on this slide, and you'll see that continue throughout. One area, and we knew this was negatively trending even prior to the pandemic, many areas around mental health, including self-harm, considering suicide, attempting suicide, and the percent of students who've actually received medical attention following a suicide attempt were really concerning. And in 2021, these areas remained so, or even increased our level of concern. The next couple slides will focus on alcohol, tobacco, and other drug abuse, which is oftentimes can be referred to as ATODA for shorthand. These questions, there is some good news within this. Our students who are vaping have actually reduced 16% since 2019, which is excellent. However, as you look at the data, the number of students that are actually using alcohol, tobacco, and other drugs, they're using it at a younger age. So we see fewer number of students engaging in it, but they are engaging at an earlier age. I'll just give you a second to look through these next couple slides that continue in similar trends, although use of marijuana is slightly down, and use of prescription pain pills is slightly down as well, trending in a positive direction. All right. And here we just see a snapshot of the middle school. Again, these were newly added questions for our middle school students, knowing that some of the trends were showing earlier age as well. So we'll just give you a second to look at that one. Okay. And then the next category under sexual behavior and dating violence, similarly, there are some positive trends. The students who have ever engaged in sexual intercourse is reduced by 4% in 2021. We also see a significant reduction in students being forced to do anything sexual, which was a good celebration. And yet, the students who are engaging in a type of sexual activity are doing so at a younger age and with more partners. Excuse me. So, a couple of things that we need to pay attention to and keep our eye on in this data.
Thank you, Emily.
I will talk a little bit about social support and housing. Supportive adults are an important resource for kids. Even the presence of supportive adults in a young person's life is an important factor. So you can see while some of this data is trending in an undesirable direction, some of the numbers remain pretty high. So 81% of high schoolers and 79% of middle schoolers have at least one supportive adult besides a parent that they can turn to for questions. One thing to look at is access to stable housing. Stable housing can significantly impact students' health and academic success. So even a move or a transition of housing, if it's voluntary and well supported, can still affect overall health. One thing to look at is potential concern is the need for additional support, and so only 19% of high schoolers and 40% of middle schoolers indicate that they are getting emotional support when needed. This slide talks about eating habits. There's some room to improve around fruit and vegetable consumption, but these numbers align closely with state averages. One thing to look at here is 21% of high school kids and 33% of middle school kids reported hunger due to lack of food at home. Looking more closely at the number of students who had eaten breakfast every day, this is low, about 30% and 38% respectively, but while missing breakfast may be a choice for some students, lack of food could be an issue for at least some of these students. This slide touches on physical activity. As we know, sleep and exercise are important for development and academic performance. Late night screen time can affect sleep, and all of this can affect both mental and physical health. I want to draw attention to the lines number 2 and 3 on this slide. You can see under watch 3 or more hours of TV per day, the 2021 box is grayed out. This question was actually added to the question below it, so you'll see that there was quite a large jump from 43% to 79% in 2021 of students who spend 3 or more hours per day on the phone, Xbox, or other device. And so that question number 2 was added to question number 3, which could lead to that jump in percentages. This slide talks about traffic safety. This looks particularly at the behavior of a student in a vehicle or on a bike for middle school students. The data indicates high level of seatbelt use and low percentages of high schoolers who rode with a driver who either drank or drove themselves after drinking.
All right, we're going to switch gears into the questions that really center around injury and or violence and safety. We're starting with our high school results and some trend data here. As you can see, there's a lot of movement in desired direction around this, which is excellent. Probably most noteworthy is the overall indication of bullying being a problem at our school did drop 11% from 2019, so it's down to 31%, which is movement we want to see, as well as the composite measure. So sort of, all the questions that asked about bullying, when composed together, they're still decreasing about 5%. So we're seeing less reports of bullying in general, as well as less reports of fights in general from the year prior. We also should acknowledge that 1 out of 5 students have witnessed some kind of violence in the community. So that is an important number to remember as we support all of our students. And then we should also acknowledge, although bullying has been indicated in fighting a little bit less this year, we have seen a bit of a decrease in terms of students feeling safe at school. So some might draw some correlations as well to increases in some of the mental health numbers that Emily spoke about earlier, but we do want to acknowledge that that is one piece that is going in an undesired direction. And then when we look at our middle school, again, don't have any trend data from our middle schools because of prior administrations that didn't take place. However, you will see here that about 3 out of 4 students most of the time or almost always feel safe at school, and that 40% do believe bullying is a problem. So we see much higher levels of bullying reported at our middle schools. And the same with fights, 17% indicated that there had been involved in some kind of fight, which is 5% higher than our high school measures. And then I would want to acknowledge that 84% of our students are indicating that they feel safe in their neighborhood.
So this next section actually starts to break down some of these themes that Luke actually just spoke on by high-risk populations or higher risk populations. So the first section focuses on students of color. If you look, they focus the middle school and high school. At the top, it calls out the sense of belonging, and at the bottom, it calls out feeling bullied at school or online. And then it's broken down by Hispanic, other non-Hispanic, and white non-Hispanic groups. Now, I think the important thing to note as you scroll through these next few slides is the scale changes. So these are actually lifted from the reports that we get from the YRBS data, and the scales do not remain consistent. So while there might look like there's a significant discrepancy, the scale might have changed. So just make sure you pay attention to that. Definitely, our first section, these next couple slides focus on students of color. We see some trends around our students who are identifying as Hispanic or other non-Hispanic. Some concerns around having an adult or another trusted adult at school to talk to. And then poor mental health, which I think is actually on the next slide. And then as well as feeling bullied or feeling a sense of belonging at school. So a couple of things we want to note and pay attention to there. The next couple of slides focus on LGBTQIA+, and again, some concerns around a sense of belonging at school for them, both at the middle school and high school level, and feeling bullied online or at school. In that next slide, it talks again about having a teacher or a trusted adult to talk to, or mental health concerns as well. Again, some things we want to pay attention to for our higher risk students that are identifying as LGBTQIA+. The last couple of slides in this section, I'm going to turn it over to Luke to talk about.
So one of our other higher risk populations that the report disaggregates for us is our students with special education services. And as you can see here, there are some celebrations in this data as well as some areas to look at a little bit closer. When it comes to sense of belonging, we can see here that it is fairly similar at middle school in terms of the percentages not being that big of a difference when we disaggregate our students with special ed, IEP, or 504, as well as those without, or those with historically or past services. That gap widens a little bit more when we get to the high school level in terms of sense of belonging. And then we go to the bullying at school and or online. We do see some discrepancies there. For special education at the middle school, it's about 4% difference from those with IEPs and those without. And then again, that gap has widened when we get to high school, and we see about a 14% difference in terms of students who are reported being bullied at school or online. This then takes us to having a teacher that they could talk to. Here's one area that is a celebration, especially at the high school. We see our students with IEPs do report having more individuals who have teachers that they can talk to or an adult at their school, and that gap is bigger at the high school level. And then we also see at the middle school level for any mental health concerns fairly consistent across the board as well as the high school, so not a huge gap there. And then I would be remiss if I didn't say the overall reports that the DPI gives us that have 100, 150 plus pages do have a lot of other areas, a lot of other content we could go into. We tried to keep this presentation as high level as possible, but we're happy to discuss further any other data or any other pieces that might come out of the report or when you're looking at it a little bit more closely. So this lends to then, what do we know helps? When we're looking at these risky behaviors and some of the health pieces, there are a lot of factors that help student well-being and different ways that schools can help. So I won't read through this entire slide. I think we've heard a lot about how important that relationship is and having an adult at the school that you can trust and come to, as well as different programs and organizations. So you'll see both in our strategic plan and a lot of the work associated with it, we're really trying to strengthen a lot of partnerships that we have with different agencies to be in our schools to support our students, as well as consistencies for all students when we talk about what we're providing universally and then at different levels of support. Certain curricular work feeds into this as well in terms of making sure we have diverse curriculum that represents different backgrounds, as well as different practices and policies. Another piece, as you heard from Emily, is the mental health concerns that were already trending in a negative way and had only been exacerbated by the pandemic. We see a lot of work and support, and we know that gaining access to mental health treatment supports and services is something that is research-based and is encouraged by the DPI as well as at a national federal level, and that's one reason why we have it so embedded in our strategic plan in terms of really supporting students' mental wellness. And then Emily will talk a little bit more about some of the other strategic plan connections.
So more specifically around strategic objective 1.7, that was really around the special education and student services audit that was conducted. We have focused on really building that multi-level systems of supports. That I like to think of as a safety net so that we ensure that we are catching students early at the earliest indication of risk. The YRBS data often articulates some of those higher levels of risk that we want to pay attention to, and so how do we support that earlier on and more proactively through having strong data-based teaming processes that give students the supports and interventions that they need, and also create just welcoming schools and a strong sense of belonging for all of our students. 2.1 and 5.1 really focus on that equity framework, which our colleague LaShonda Holland has been working on with the DEIA committee. That's been focused on increasing a sense of belonging, of value, and acceptance in schools, so we're excited to see that work continue to unfold throughout the year, along with the DEI training that is being conducted with that committee and the DEIA advocates. Around goal area 3, again, the strategic plan and those mental health concerns that existed prior to the 2021 data being released sort of converged already in developing that goal area and having the focus be around a stronger sense of mental health supports and social emotional wellness development in our schools. So 3.1 really focuses on creating a framework that sustains that kind of goes along with 1.7, that multi-level system of supports. And then 3.4, as Luke mentioned in the previous slide, really increasing access to social, emotional, behavioral supports. We've come before you to discuss Care Solace in the past. We are working on school-based mentoring or creating stronger mentoring partnerships with community organizations. This data, I think, helps us go even more specific into what students might be best suited or how we go about creating those partnerships. We're looking to do a request for proposals for school-based mental health providers in addition to that. We've been working with the health department, really value that collaboration that's been growing over time, specific around social work support in our schools, and alcohol, tobacco, and other drug abuse support with some of the newly hired supports at the health department. Really looking at strengthening our second step at the elementary level, and which is our social emotional learning curriculum, and then adopting one or identifying one over the next year or so to use 6-8 at our middle schools. We have also ensured that all schools have an updated community resource booklet. It's a pretty thick booklet that lists a number of community-based agencies in the Milwaukee County area, and it touches on pretty much all areas mentioned within this YRBS data, including food insecurity, housing, access to community resources, etc. All of our student services staff have access to it and can easily distribute that to families as needed. We've really strengthened our processes around suicide risk assessment in the last semester. We've had a small team of counselors, social workers, psychologists, and mental health specialists looking to ensure that we have a strong process that all of our team members know and how to operate from that process so that we can catch students earlier and match them with supports that is necessary both in school and in the community and in partnership with their families. We've also added a content team leader focused on alcohol, tobacco, and other drug abuse. You may have noticed that there have been some great community-wide events already, and she's done a wonderful job bringing some additional learning to our student services and administrative team. And then, of course, over the course of the last few months, we've been able to utilize and leverage those ESSER positions that were funded, those social emotional specialists and the secondary mental health specialists, who've been a great addition to our team to just add more boots on the ground, direct support to our students and staff within the schools. We have started to take a look at this data with multiple stakeholder groups. So earlier in January, we started with the student services team. Again, that includes our counselors, social workers, psychologists, social emotional specialists, and mental health specialists. And we used our time together to go through a pretty in-depth data protocol to guide some data review and some dialogue to think about what's already in process that aligns with this data and supports improving these outcomes, and then what might be some things that are missing already that we need to consider in the next few months. On January 25th, we did a similar activity with all of our administrators at the meeting that we held that afternoon. Similarly, we went through a data review process and guided some dialogue and action planning, which will hopefully also improve some of the specific action steps listed within school growth plans. And now we are preparing for our school board presentation on February 13th.
Many of the things we've discussed today align really closely with the work that we're doing in the health department as well. And like Emily mentioned, we've been able to provide some support to the school district. With some of our ARPA and COVID funding, we've been able to hire a few positions to focus specifically on mental health and substance use. We recognize the importance of addressing these issues. They've been areas of focus for us for several years before the pandemic, but we've really seen these become highlighted and exacerbated by the outcome of the pandemic. We've seen many families struggle, even when resources are available, to sort of navigate those complex systems, and so we were able to hire a shared social worker position with health, police, and fire to really work closely with residents to access some of these services in our community. We also hired 2 youth mental health social workers to work directly with the school district to provide additional mental health support. And then we recently hired a substance use specialist to provide community education and harm reduction services to the community. We also have a community health improvement plan in the health department. 2 of our focus areas for this 5-year plan are mental health, with a focus on social connectedness and substance use. So we will continue to provide support to the school district through education, helping coordinate speakers, or anything else that we can help support with the initiatives that we're working on.
So as we start to wrap things up, I do want to call attention to 2 upcoming events that we have. One, Wear Your Heart on Your Sleeve. This is an event being organized by our content team leader with a focus on ATODA, or alcohol, tobacco, and other drug abuse. It is also being done, it's an event that a couple of other area school districts have brought in. It's in conjunction with Rogers Behavioral Health, hosted by Tom Farley, Chris Farley's brother. He openly speaks about his family's struggles with addiction and mental health. And there will be some additional mental health professionals on a panel, including a local parent, to speak about their experience. That one is happening February 16th at 7 p.m. at Wauwatosa East, and it is open to our school district community. We also have More Than Sad, which is suicide prevention for parents. So it'll be a really good overview on signs to look for, things to consider as a parent. If you are at all concerned or just curious, I invite you to come and join us on March 8th from 5:30 to 7. Again, that one will also be at Wauwatosa East.
And then we wanted just to drive back just to some resources. Certainly we could do probably a multi-hour presentation on all the various resources that could support all of the areas that we've spoken here today. But we wanted to draw our attention to some high leverage ones. We have the Community Resource Guide and a Substance Use Information Guide that the Health Department has put together. That's a great resource. Of course, we have Care Solace that can help mental health navigation, depending on any kind of concern or substance use issue parents and or their children or anyone in their household might be navigating. We have our Aurora Student and Family Assistance Program that is available to our families at no charge. There's the Walk-In Mental Health Clinic, and the Department of Children and Families just released a new resource that is a resource hub for LGBTQ plus resources, and that's a really, really great, again, hot off the presses, aggregate of all sorts of resources we might need. There's Diverse and Resilient, as well as the Children's Hospital Special Education Resource List. We also don't want parents in the community to forget about our student services teams that Emily had spoken to in the schools for that direct level support during the school day. And we are working to continually update and get our website in a better place so we can make sure we're compiling these resources in one space, in one place, in an easily accessible manner for everyone. We want to thank the board and our community for hearing us today, and this is the time when the presentation ends and we'll ask for any questions that you might have of us that we can answer in person. Thank you.
Thank you.